The surge in cases of COVID-19 continue to hit Fraser Health hard as it continues to account for over 2/3 of the total cases in the province, with about half of those cases in Surrey. But how is COVID impacting diverse communities which represent a sizable population in Surrey?
We don't actually have rates by ethnicity of disease.
And some members of the South Asian community living in the Fraser Health region are asking why.
Data that shows which communities are more heavily impacted would definitely empower people to take informed action.
It's not that we should be targeting a community. We know that there has been transmission in every community.
But Singh says it's not targeting as much as it's dangerous not to be direct.
Right now, seeing the number of cases in Fraser Health and seeing the number of cases in Surrey, the people who are bound to use this information to target or to scapegoat are already doing that, frankly.
While she won't give the numbers, Henry does say there has been a disproportionate increase in COVID-19 cases among BC's South Asian population. But she says the spread doesn't have to do with ethnicity. Rather, it's to do with many South Asians being essential workers, truckers, and plant workers, putting them at a higher risk. Singh says the reality is the risk remains if the data isn't shared. He says the outreach the province is doing, like ads in different languages, including Punjabi and Hindi, are great, but it's not enough. Which is why his own community has stepped in to educate. But without the numbers, he feels his community isn't being given a fair chance.
When we provide information directly to communities in culturally relevant ways, we can actually prevent a lot of these issues from coming forward.
Something BC's Human Rights Commissioner echoes.
We need to understand the problem in order to solve it. So we should be collecting this data going forward. The problems could be quite different for different populations of people.
Singh says it's a fine line to tread between targeting a community and sharing the facts, but he stands by his belief that collecting ethnicity data on positive cases and deaths could better equip communities and ultimately help bend the curve. Zara Premji, CBC News, Vancouver.